My name is Geoff Yurcisin, and I'm a general surgeon at South Georgia Medical Center. I'm a general surgeon, which historically has meant we kind of operated all over the body, and we still do nowadays with a little bit more focus on the abdomen, the bowel, and hernias and things of that sort. As long as I can really remember, I remember wanting to be a physician. Originally, I think it was a neurosurgeon back in middle school, and as I went through college and was doing some volunteer work and shadowing, I started following some general surgeons, and I remember one day leaving and just feeling like, you know, I could almost hang out with those types of guys one day. You know, I kind of wanted to be part of that group, and so that formed my direction going into medical school. And when I went into medical school, I remember I was one of the only people our first year, we all had to say what we wanted to go into. And I picked general surgery and ended up matching into that 4 years later, and really have never looked back and really enjoy what I do. I try to be very transparent in my thought process. And so when I see somebody and I'm talking about, you know, what I think is going on with whatever maybe disease process they have or whatever chief complaint that they came to my office for, I really just try to tell them, hey, look, this is what's going through my head and what I think is going on with you, and these are our options, you know, and I kind of present them all out, and I say these are all reasonable options, and we kind of go over them all, and we try to come to the one that they feel is best for them and it's going to work for them. They're never being kind of ushered into a decision. They're making a decision kind of in concert with me, because I'm basically, that's how I see my role. I'm supposed to provide them with information and a skill set, but helping them make a decision that's right for them. You know, when I was out on my own, I recently had a patient that presented to the emergency department with perforation of their colon, and they were starting to get really septic. And I remember rushing into the ER and going to see this woman and removing part of her colon. And I remember her coming back to see me in the office, you know, a couple weeks later. She had gotten out of the hospital, she had gotten better, and, you know, she said to me, look, I don't really remember that day, but you saved my life. And I was just like, it really kind of took me aback, because I'm like, well, I didn't really, you know, I was just doing what I was supposed to do. But it was like having me see something from a patient's point of view, and it really kind of touched my heart. And, you know, she was like, I'll never forget you, and all this other kind of stuff. And so it was just really, that was a really cool moment that I'll cherish forever.